In this video, I'm going to give a couple pointers on doing back-to-back cases. That would be doing both first and second molars together and opposing arches. And there's a couple tricks there. So I'm going to go ahead and discuss that now. You can see on this model the 6-year molars are present. When we're dealing with opposing arches, really the issue is when the 6-year molars aren't present. So when you're just in the primary dentition, and I'll talk about that more in a minute, but I went ahead and I took out those teeth, so you can see we just have the primary dentition here. Okay, so we're going to go ahead and start our prep, and step 1 is occlusal reduction. If you want more detailed instructions, go back and watch our posterior preparation video. For this video, I'm assuming that you've already seen those videos, so I'm going to kind of go through the preparation rather quickly here. But if you want more detailed instruction, just go back and watch the prior videos on posterior zirconia crown preparation. So first step is I'm going to do my depth cut. I just make a trough in the middle of the tooth, the thickness of this burr. So go ahead there. So you can see here, if you look at this from the side, you can see that is our depth. That's 1.5 millimeters of occlusal reduction. I do that one, and then I do a trough right down the middle of the first molar here, the thickness of that burr. So you can see right there, that's our reduction there. So we have occlusal reduction, depth cut there, 1.5 millimeters. It's like a slot that burr goes into, 1.5 millimeters right there. Then all you need to do is go in and flatten everything else out so that it's nice and smooth. One of the nice thing about sprig crowns is that you do not need to have a fancy occlusal reduction like some of the other brands that require you to do an additional amount of reduction in the central fossa. With ours, you just do a nice flat, very easy occlusal table. So you can take a look at that there. That's our completed occlusal reduction. This is our racetrack axial depth cut. So I'm going to go ahead and place a small line right here. Remember, we're going to prep to the tissue. We're not going subgingival yet. And I will make a groove right along the gum line here. So one thing to remember is that when you're doing back-to-back teeth, I do the occlusal reduction together. The racetrack axial depth cut, the second step, I do separately. I'll do one tooth and then the other tooth. And then the third step, the subgingival reduction, I do together. And I'll show you that right now. So basically, going in approximally. And remember, once again, we're creating a cylinder. So we want to keep our handpiece straight up and down. And once again, for the purpose of the video, we go a little slower so that I can make it look pretty, so I can have a good teaching experience. But you can see I'm basically making this racetrack the thickness of the tip of this burr, which is 0.8 millimeters. You want to make a racetrack 0.8 millimeters or a depth cut or a shoulder margin, however you want to call it, 0.8 millimeters around that tooth. Same thing on the lingual. I'll create a little line there. That's my starting point for my racetrack. Once again, burr angulation, hold your handpiece straight up and down, perpendicular to the occlusal surface, or if you're dealing with anterior teeth, parallel to the long axis. The tooth, so I'm just creating this racetrack, and once your racetrack takes shape, it's almost like it's really easy to prep because I can just cruise around because your racetrack actually holds that burr in place. So I have a racetrack all the way around that tooth. So you can see that there. So let's take a look from the occlusal view. You can see I have a nice shoulder right here all the way around. I can identify that shoulder all the way around. My racetrack is a little bit faint on the inside. I can't really see it. I can see it here, but I don't see it here very well. One of the visual references or visual checkpoints is you need to be able to see that racetrack completely visible all the way around. So I'm just going to go in there and I'm going to do a little bit more reduction, because you want, once again, you want that 0.8 millimeters. There we go. So now you can see that's my completed racetrack on my second molar. I can see that all the way around the tooth. It's clearly visible. If you don't see it, you don't have enough. Go back, remove it, so you can easily identify within 1 second of looking at it. You should say, okay, I can see that racetrack all the way around. Now we're going to go ahead and do the first molar, and the reason why I do the occlusal reduction together, it's very simple, to just kind of do them together. The racetrack axial depth cut, I like to do one tooth, complete it, and then do another tooth, and then complete that. And I do them separately because a lot of times if you were just to slice through here, which a lot of doctors will do, if you just slice through, you don't know if you did more reduction on one tooth and less on the other, so it makes it harder to judge if you have the right amount of reductions there. So that's why I like to see one racetrack, and then I'll see another racetrack. So let's go ahead and we'll start our racetrack on the first molar, creating my initial little line right here. I'm just going to go kind of fast. I always like to do the buccal first, then I'll kind of carry that interproximally. This is our lesson in mini pros here. We're doing little mini crown preps. So you can see on the buccal, you can see the racetracks taking nice shape there. I already started the interproximal. Now let's go do the lingual. So I'm going to make a nice little line here along the tissue, not going subgingival yet. I'm going to carry that on the lingual. And once you have that racetrack, then your handpiece just kind of stays in that groove right there. It's like a road or a train track. Maybe I should call it a train track instead of a racetrack. But that will guide you as that starts to develop. All right, so you can see that's our completed racetrack on your first molar and a completed racetrack on the second molar. So we have two completed racetracks here. So now we're going to go ahead and go to our subgingival reduction. Where you enter the tissue is important to minimize tissue trauma. It'll make less bleeding, which will make cementation easier. So you either want to enter at the distobuccal or mesiobuccal line angle. That's where the tissue is the firmest. So I'm just going to make a small little hole here, and then from that little hole I'm going to fan out, and as the ledge starts to disappear, or that racetrack starts to disappear, then I have more room in the sulcus, and now I can upright my handpiece and go the full 1.5 millimeters to 2 millimeters below the tissue. So as far as like sequencing goes, once again, I do the occlusal reduction together. I do the racetrack axial depth cut step separately, or individually, I should say. And then when I'm doing my subgingival reduction, I go back to doing it together. So I do the buccal on one, then I do the buccal on the other. You can see my burr angulation here. I'm almost angling the burr inward as if I was going to create an undercut in that. So I'm removing any ledges. When the ledges are gone, it should feel nice and smooth. So I'm going to carry that interproximally. So buccal, buccal, interproximal, interproximal. Then I'll go ahead and do the lingual. And when you do the lingual, you have two options. You can either just carry it through from the interproximal like I'm doing here. So once again, watch my burr angulation. I'm going the full 2 millimeters below the tissue. Or, blow that for me. So I either carried my subgingival reduction from the interproximal into the lingual without lifting my burr out of the sulcus, or you can create a new little hole like you did on the buccal and then once again fan out from there. So just a couple different options that you have, but it's really important that you kind of incrementally enter the subgingival area to minimize tissue trauma so that you don't have a whole bunch of bleeding when you're doing your cementation. So now you can see I'm uprighting my burr, and that's nice and smooth. And you can tell when you've got your subgingival reduction good, because as you go around that tooth, it feels nice and smooth. So now the last step you want to do, as I call it the ring around the rosy, you're just going to go around 5 times, 2, 3, 4, 5. And you can see I'm almost angling my burr inward as if I'm going to create an undercut. So let's do it on our first molar. There's 1, 2, 3, 4, 5. So that's our completed preparation. So you can kind of see here, we've got our preps done. Whether or not you want to round these angles here, the axial occlusal line angle is an option. Loma Linda University did a study where they tested rounded versus square line angles and tried to fracture the crowns over those rounded and squared preps, and there was no difference. So it really makes no difference if you want to round them or not. I personally don't round them because these are a passive fit crown, they're a loose fit. I always feel like leaving it square gives you a little bit more lateral retention. Is there any research to prove this? No, just a personal preference. Okay. So here's the tips that I wanted to show you when you're doing back-to-back and opposing arches. If you have space loss and the crowns are tight together, then a lot of times I'll go in and I'll just disc or take a tiny bit away of the distal of this cuspid here, because what you don't want to have happen is you don't want, because the crowns are a little bit of a loose fit, if it's tight, you don't want it to get pushed distally and encroach into the eruption of the 6-year molar here. So I like to just create a little bit of room by disking the distal of that cuspid a little bit, and it just kind of loosens it up so those crowns can fit nice and passively. So that's tip number 1. When you try the crowns on, you want to try them on individually. So you want to try first your second molar, and that fits nicely. Once again, with practice, you'll be able to seat these crowns the first try. You just have to make sure to do the same steps over and over again. And then I'm going to try on our space loss. You can see the red lettering denotes a space loss crown, and that fits nicely. Then once you try them on individually, then we can try the 2 on together, and those should seat down just fine. And they do. So that's your completed back-to-back preparation. The other comment that I want to make is when you are doing opposing arches, I always found that I would do a posterior reconstruction where I'm doing all 8 back teeth, and I would get done, and I always felt like I had a very accurate reduction, and when I would get done, it would always be high on the distal lingual cusp of your upper second molar, and it would be a little bit high in the back, and you can tell that by when you close the bite down, you can see a little bit of opening in the anterior. So what I've done is when I'm doing an opposing arch, rather than having a flat, straight occlusal reduction, I'll actually go in and I will take away the distal 2/3. So I'll start maybe right about here, and I actually will slant my occlusal table down. So you can see I can slant my occlusal table down here. So you can see them from the side here. Let me see if I can show that better on the camera. But you can see that the side view, it kind of slants down a little bit. That does 2 things. Number 1 is it will allow your crown to tuck in a little bit on the distal. You can kind of see that, how it tucks in a little bit on the distal. I like that because I don't want an overhang to encroach on the erupting 6-year molar. With zirconia crowns, you can't crimp them or adapt them like you could a stainless steel crown, so you need to make sure the crown fits properly. That's done by 2 things. Number 1, using the smallest size crown possible, and that's from doing your preparation correctly. And then secondly, if you slant that distal occlusal table a little bit, it kind of tucks the distal of that crown in there, which I like. The second thing that this does is that when you're doing opposing arches, it gets that distal lingual cusp out of the way so that your bite will not be high. When I started doing this several years ago, my bite when I would do posterior reconstructions would be spot on every single time. So that's it. How we doing? Is that okay? I think that's gonna be a good video. I had a lot of little pointers in there. I think people like.